Sydney Estes. All right. And I'd be sure to plan medication administration to have no interruptions. I would keep the medication room door closed. I would not take any phone calls, and I would limit any conversations with colleagues to just essential information. So the first thing I'm going to do is I'm going to compare my order form and my MAR. So I have got Jaguar J. Jones, medical record number 4176352, 4176352, allergy is penicillin. For the medication, we got morphine, and morphine is 5 milligrams, IM injection, every 4 hours. It's PRN for pain and PRN for pain. So everything matched accordingly, and all elements of the legal prescription are there. So I'm going to go ahead and set my order form to the side, and I am going to perform hand hygiene, and I'm going to start my first check of accuracy. So I have got Jaguar J. Jones still, and I have morphine. That is what is in my vial. The expiration date is 12/20/2025, so it's not expired. The dose is 5 milligrams, and my vial is 10 milligrams per mil. So I will give half a mil, and I'll go ahead and just write that down so I don't forget it. And whenever I do a calculation, I would double check and verify with another nurse. So it is an IM injection, so I'll get all of the supplies for that. So I will have my 3 milliliter syringe, my blunt plastic cannula, and my 23 gauge 1 inch needle. So I will now draw up my dose. So I will perform hand hygiene again. I would clean my vial, and I would grab my syringe, making sure not to touch the tip of it, and apply my blunt plastic cannula. Since it is half a mil, I will draw back half a mil of air. Remove the cap. Make sure you can see. And I will inject the air into the vial and draw back half a mil, being sure to get rid of any air bubbles that I may have. And I will scoop this back on. And since it is an IM injection, I will take off my blunt plastic cannula, place it in my sharps container, and apply my 23 gauge 1 inch needle. And as you can see, I have drawn up half a mil. And then, so it is for every 4 hours, and Mr. Jones has not had it in the last 4 hours, and it is for pain, and he is now complaining of pain. So all elements of a legal prescription are included, and that completes my first check of accuracy. So I'll now start my second check. So once again, we got Jaguar J. Jones still. I got morphine. That's what's in my vial. And then that's what I put in my syringe. It is for 5 milligrams or half a mil, and that is what I have in my syringe. It's an IM injection. This is a good needle and a good syringe for an IM injection. It's every 4 hours, and Mr. Jones has not had it in the last hour, or the last 4 hours. And it is PRN for pain, and he is now complaining of pain. So all elements of a legal prescription are included, and that completes my second check of accuracy. So I'm now going to make my label, so I'll grab some tape. And so I got Jaguar J. Jones, so I'll go ahead and write that on my label. And I have morphine. That is what's in my vial. And then that's what I drew up in my syringe. And then it is 5 milligrams or half a mil. And it is half a mil because my vial is 10 milligrams per mil. That is what I drew up in my syringe. And I'm going to go ahead and place this on my syringe. And I am now ready to go to my patient's room with my medication, my syringe, my MAR, and some alcohol pads. So I will go to my patient's room. And I would knock on the door. I would introduce myself. Hey, Mr. Jones, I'm Sydney. So I'm going to be giving you your morphine medicine today for your pain. And so I would explain the procedure. And then I would raise the bed to a working height, lower the side rails, and I'm now going to verify that it is the correct patient with the armband and the MAR. So I have got Jaguar J. Jones, medical record 4176352, 4176352. The allergy is penicillin, and the allergy is penicillin. I would now ask if there were any other allergies that I needed to be aware of, and there's not. So this is also where I would do any pre-administration assessments that needed to be done. So before I give the injection, I'm going to do one more check for accuracy. So I got Jaguar J. Jones here on the MAR, Jaguar J. Jones on his armband, and Jaguar J. Jones on my syringe label. And then I got morphine. That's what's in my vial. That's what's on the label on the syringe, and that's what I drew up in my syringe. It is 5 milligrams or half a mil. That is what is on my syringe label, and I drew up half a mil in my syringe. It is an IM injection, and this is a good needle and a good syringe for an IM injection. It's every 4 hours, and Mr. Jones has not had it in the last 4 hours, and it is PRN for pain, and Mr. Jones is now complaining of pain. So all elements of a legal prescription are included. And that completes my third check of accuracy. So I'm now going to give the injection. So I'm going to wash my hands. I will apply clean gloves and goggles. All right. And so now I would have position the patient for a ventrogluteal injection site. I would have them facing towards me, and I would find the greater trochanter, and I will clean the injection site in a circular motion, being sure to not go over any area that I have already cleaned. I'm going to go ahead and just leave my alcohol pad there, pointing to where I'm going to inject it. So I'm going to remove the cap and place it in my sharps container. And with an intramuscular injection site, I will spread the skin, and inject at a 90-degree angle. I would aspirate for any blood. And I don't see any, which is good, so I will slowly inject the medicine. And I will dispose of it, the needle and syringe in my sharps container. I will apply gentle but firm pressure to the injection site. And then I would remove my gloves and goggles properly, glove to glove, skin to skin. And I would now reposition the bed, lower the bed, raise the side rails, and tell the patient that I am now going to go back and document, and I would document the procedure and how well the patient did on the procedure. And I would also let them know that I'd be coming back soon to check and make sure they're okay and that they're not having an allergic reaction. And that completes my medication administration checkoff.